Today we're going to talk about vitamin D. We're going to talk about the benefits of vitamin D and who may be at risk for vitamin D deficiency, as well as if anybody could be at risk for vitamin D toxicity, if there's anything else you should be taking with vitamin D. It's that time of the year to have that discussion. Well, the first thing you might want to note is that vitamin D is a misnomer. Vitamin D is actually not a vitamin at all. It's actually a hormone. So it's a signaling molecule that helps regulate certain physiology in multicellular organisms. So it's going to be able to be transported from tissues to other tissues and help regulate what's going on with those tissues and how they function. So vitamin D is actually a hormone. I don't keep track routinely of how big the population's gotten globally. But I do know that as of I think 2 years ago, about 1 billion people are considered vitamin D deficient, and we will get into what would be classifying that a little later in the video. Also, I believe it's 35% of the United States is deficient in vitamin D, as well as 61% of the geriatric population. And we're going to talk about why all of that might be important in a little bit here. So with a couple of those facts being said, who in particular outside of those demographics might be at risk would be people that are not getting as much sunshine, because that activates vitamin D into the active form in your skin. It turns it into cholecalciferol, I believe vitamin D3. So people closest to the equator are the least likely to have vitamin D deficiencies. That's why as you get farther away from the equator on the globe, you're more likely to be deficient. But there's also a really unique link that we had found too, or I personally haven't found it, and I thank all the people who did all the work to find this. In 2019, the study was, I believe. Yeah, so it was... Let's see, it's the most comprehensive review of multiple sclerosis to date, it looks like, and they found a statistically significant positive correlation between your distance from the equator and the prevalence of multiple sclerosis. So let's see, your distance from the equator, you're more likely to be deficient in vitamin D. Your distance from the equator, there's a higher prevalence of multiple sclerosis. Not saying there is a direct correlation there, but that's something to be thoughtful about, okay? Something else to talk about with vitamin D is its direct link with depression. So there's been cross-sectional studies, cohort studies, case control studies, but they all found unified, or in unity, they all found kind of in alignment, I should say, that patients with vitamin D deficiencies were more likely to be depressed, but even more so, or furthermore, the worse the vitamin D deficiency, the more severe rated the depression was. So, I mean, that is a direct correlation. Again, vitamin D deficiency was linked to depression, but also the severity of the deficiency of vitamin D corresponded to the severity of the depression. So vitamin D2 and vitamin D3 eventually are transported through your body towards your kidneys, specifically the proximal tubule, where something very pivotal happens. It ends up turning into 1,25-dihydroxycholecalciferol, also known as calcitriol. That is the active form of vitamin D. So this calcitriol can get down to the DNA level and help the DNA express at least 500 different variety of gene functions to regulate physical functions. So we're finding at least 500 different areas on your DNA that vitamin D, the active form calcitriol, is affecting and effectively helping express certain ways to regulate your physical functioning. So just kind of an overarching importance of vitamin D as a hormone and how active it is in a role it plays in your body. So which one is more efficacious, vitamin D2 from plants or vitamin D3 from animals for raising your serum level of vitamin D? Well, a meta-analysis was done, and they had found that vitamin D3 essentially was more efficacious at raising your serum vitamin D levels, which is what we're after. So I highly suggest, if you're going to be supplementing at all with vitamins for D or the hormone, right? Pick a vitamin D3 supplement, as well as getting it from animals in your dietary needs, or just getting more sunlight if you prefer not to eat any animals, of course. And I apologize if my eyes sometimes go off from the camera because some of this information I'm just unpacking again here, and I'm not recalling it all to you right away, like this one right here. I mean, this is pretty huge evidence, and we'll have the reference up for you, but this was a carcinogenic related mortality. So it was 50 trials. This is a meta-analysis and a systematic review. 50 trials with over 74,000 participants were identified. Vitamin D was not associated with all-cause mortality, so vitamin D didn't cause death. It was not associated with cardiovascular mortality, so vitamin D levels did not cause heart-related or CV-related death, or non-cancer or non-cardiovascular mortality. So long story short, vitamin D was not associated with mortality at all, but what they did find, again, with over 74,000 participants involved, is that vitamin D supplementation statistically significantly reduced the risk of cancer death. Yeah, I'm pausing that long. 74,000 participants in 50 trials had shown that vitamin D supplementation was not related to any mortality, but it statistically significantly reduced the risk of cancer-related mortality. This is vitamin D. This is something you get from the sunshine, something you find in plants and food. Why aren't we supplementing this? What about vitamin D and like viral illnesses? So there was a prospective double-blind placebo study using an objective outcome. They did a swab culture, so a swab up the nares there at a therapeutic dose of vitamin D, showed a statistically significant 42% decrease in the incidence of influenza infection. And that makes sense because there are vitamin D receptors on B cells, T cells, antigen-presenting cells. Again, relating back to vitamin D being a hormone that can affect things from the level of DNA and help the DNA to downstream express proteins that are going to regulate physiological functioning. And that's everything from obviously your brain, like we were talking about earlier on, all the way down to the immune system here. So the list goes on and on with vitamin D. So they did a bone mineral density study, negative scores. Hopefully we'll have this picture up for you. Negative scores defined osteoporosis, but what they did was they, again, did the bone mineral density study. And we're taking a look here at people that had certain levels of calcium in their bone, and this would be defined as, so what we're looking at is calcium levels, but then the serum level of vitamin D that they have inside, okay? So people under 20 nanograms per milliliter, you can see their calcium levels there. People with over 20 nanograms per milliliter of serum vitamin D, you can see their calcium score, calcium level there. So it's almost double. Obviously, no one is in the osteoporosis window here on this, but look at how much higher just from having over as little as 20 nanograms per milliliter serum level of vitamin D, your calcium is at in your bones. So osteoporosis prevention, vitamin D is integral. One thing I did want to mention about the vitamin D is that you want to have K2, vitamin K2 taken together with it. That would be the most optimal way to do it. As we just looked at a graph there that showed, it was from a femur bone, but it showed the calcium concentration in the femur, and that's related to the serum levels of vitamin D. Well, that's because vitamin D is going to help your body pull in calcium. But calcium is kind of almost flying blind. It likes to bind to anything in the body, including inside of your arteries, okay? Vitamin K2, and there's going to be another pharmacist here that's going to do a video on vitamin K2, but vitamin K2 not only helps direct calcium to the correct spots where it needs to go, like your teeth, your hair, your nails, your bones. They're finding, and really recently, and it's coming out more and more, K2 is exciting. It helps with arterial elasticity. It helps to some degree pull calcium out, so pulling some of that plaque out of your arteries. So taking vitamin D3, again, that's a more efficacious vitamin D, with K2 is going to be a very safe way of pulling calcium into your body and having your body use that calcium appropriately, because your bones go through a recycling or remodeling process, and that's going to have during that process, you have calcium essentially fluctuating off bone into tissue and in your vasculature, and then back into bone, vice versa. But things can get lost along the way. K2 really organizes that, distributes calcium where it needs to go. There is some evidence out there too that I believe it's the Japanese culture have the longest lifespan. And feel free to quote me or comment on this one because I don't have the study up kind of off the cuff, but I thought the longest lifespan of any first world country was the Japanese culture, and I thought they originally thought it was from fish oil and the benefits of fish oil. But I think they're finding out that the K2 in their diet and the levels of K2 they have, as well as I'm sure a few other things, but K2 being a big factor into why they've been living longer lives. Or Dan might just cut this part of the video because I didn't really cite it appropriately. I'll leave it up to him. If this makes it, feel free to comment as to whether or not that was correct. But all the other stuff I'm saying, of course, I have references to, and you should have no problem accessing it. A few different descriptions or a chart of essentially misdosing vitamin D and causing extremely high serum levels of vitamin D. So prior to me discussing this, the National Institute of Health, I believe, wants, generally speaking, they define like adequate vitamin D levels or safe vitamin D levels as between 20 nanograms per milliliter and 50 nanograms per milliliter. If you go to one side of it, less than 20, you're going to have those problems that we spoke about with your calcium and your bone protective qualities, as well as what we talked about even earlier about being farther away from latitude, vitamin D deficiency, and cognitive impairment, and potentially dementia, and potentially more likely to have cancer and a less immune system. You'd have over a 42% higher probability of getting sick. So all of those things mentioned if you're like under 20 nanograms per milliliter. But they say over 60 nanograms per milliliter could cause adverse events. I would like to just chime in, and this is where this chart comes into play. I slightly disagree. If you were going to fall one way or the other, less than 20 or even over 100, which one's safer for you? Well, look at all the benefits we just discussed, and let's look at like what toxicity is. So we have a couple people here. Ages range from a couple months up to 75 years old, and vitamin D dosing is just amazing here. We have, looks like, as little, and I say as little because most people routinely do 1,000 to up to 10,000 IUs per day. We have the littlest is 20 IUs per day for just like an infant. But for an adult, we have 50,000 IUs a day for a year. We even have someone that was taking 1.8 million IUs for 2 months. Let's look over here to the fourth column, the vitamin D serum levels in nanograms per milliliter. I think I might have a typo. That should be milliliter. We have a highest one of 1,220. We have everybody's a couple hundred, right? So that's well over 60, which was earlier defined as potentially leading to side effects. So what kind of side effect profile are we looking at? I would think potentially fatality for how grossly overdone their serum levels are. You get abdominal pain, poor appetite. Some people had some vomiting, nausea. This 75-year-old lady who took 50,000 IUs for a year, all she had was altered mental status. What I'm getting at is here, again, these are absurdly high levels of vitamin D, but none of them, from what I can see right here, none of them were fatal. I'm sure they were not comfortable, and I'm not saying we should ever go this high, but what I'm getting at is if you're going to err to being deficient in vitamin D or being leaning towards even 100 nanograms per milliliter, even higher than that, it's okay. It's not the end of the world. It's safe. And it takes time to load vitamin D, so you're going to want to do 10,000 IUs a day for a while. But the biggest thing is to test your levels. That's one of the things we offer here at MD Custom RX. We have vitamin D level testing we can do. And then we just kind of tell you or guide you on supplements, whether 5,000 IUs, 10,000 IUs, 50,000, what to do for how long, and then retest you. It's fairly cheap tests just to see where your levels are at. Because again, those benefits I mentioned earlier, even if I mentioned them in a clunky manner, hopefully still came across to you because it's breathtaking. Over 500 different genes being expressed to help the physiological functioning of your body, ranging from your immune system to your cognitive impairment and health and well-being there, depression, MS, dementia, right? gosh, it statistically significantly lowered cancer-related mortality. That's unbelievable. And then if you pair this with K2, which again, another great pharmacist will be talking about, it makes the calcium intake that you're getting from this D3 very safe. If anything, it's going to help your hair, skin, nails, teeth all look a little better. So something we should definitely be thinking about. In summary of vitamin D, according to everything I've mentioned, you are most likely deficient, and we could certainly get you supplementing to the higher side and have a lot of great benefits from that. But the main thing is just knowing your level. It's a cheap test, test it, then supplement accordingly through your diet or through a supplement or just getting more sunshine or all the above, and then retest. And once you're at what would be deemed as a safe spot, again, you don't have to go necessarily on. Hopefully I made a case for why over 60 isn't necessarily a bad thing, or why you'd want to lean towards the high end of the serum levels of vitamin D. Just stay there. Okay, you're going to find a slew of benefits, and we have all these references to back that up. So I hope you have a good rest of your day. Thank you for watching. Take care.